I got interested in airway health as a result of struggling with airway-related issues myself and my struggle with my son. As I looked for solutions to my problems, I started thinking about my own children and how I could make sure they didn't suffer the way I did as they grew. Over the last 8 years, I've committed myself to discovering everything I could find about airway health, and at some point on my learning journey, I became completely convinced of one thing. Underdeveloped airways and breathing disordered sleep are the most preventable chronic health conditions in this society today, especially when it comes to kids. Airway disorders, which are often invisible in little ones, can lead to a number of challenges for kids. Mouth breathing, allergies, asthma, breathing disordered sleep, enlarged tonsils and adenoids, poor facial development, small jaws, crowded and crooked teeth, tooth grinding, jaw pain, headaches, ADHD-like symptoms, poor performance in school and sports, bedwetting, lack of emotional control, behavior problems, the list goes on. And some children are so stealthy when it comes to breathing disordered sleep. They show minimal signs and symptoms. They can be great compensators until they are not. We don't want to wait until they're not okay. It's now our mission here at AirSync to do everything we can to prevent and reverse breathing disordered sleep. And I am especially passionate about the prevention piece when it comes to your children. Compromised airways in children are often left undiagnosed and untreated. Most of the above comorbidities are considered normal. From my perspective, that is tragic. Who wants to be normal when you can be optimal? In almost all cases, untreated airway problems will negatively affect a child's quality of life, brain development, and more in the short term, and compromise their overall health and well-being in the long term. Let's talk about why earlier is better. Upper jaw and nasal passage development is 60% complete by age 4, 80% complete by 6, and then slowly finishes up near 12 to 13 years of age. So if we see a growth or sleep problem, why are we waiting? Why not modify and guide the growth, train the breathing, train the tongue, optimize the sleep? If you could do something to help your child, why wouldn't you take those next steps? When I meet families at the airway assessment appointment, the conversation often goes one of 3 ways. Parents are dumbfounded that there are significant breathing, sleep, facial growth problems. Perhaps they were only referred to us for a tongue tie evaluation. They are thankful to hear the answers they have been looking for, and/or they are confused and sometimes outraged that their pediatrician or dentist never mentioned anything to them. Physicians and dentists are not trained in tongue tie, restrictive tethered oral tissue assessment, airway health, breathing disordered sleep, jaw development, breastfeeding, oral function. Medical professionals are generally taught to monitor symptoms and then do something when it's really bad. So as a society, we are largely ignoring or monitoring signs and symptoms in our children that could be easily and efficiently rectified to better their lives. That's why we want to see the little ones as early as age 3 for an airway assessment. We can help kiddos as young as infancy. The airway assessment, 3D imaging, sleep test, and other airway-related diagnostic tools we use with children are not threatening and comfortable. Our goal is to get a snapshot of how their airway has developed so far and a baseline trajectory of what's going to happen moving forward. We do not recommend watching and waiting. It's been our experience that kids don't outgrow airway-related symptoms. Unfortunately, we see the opposite. When it comes to children, airway problems do not recede or get better over time. They progress and get worse unless we intervene, and the sooner the better. That being said, we have age-appropriate and effective airway treatment options for children of all ages. From infants to adolescents to teens, the earlier we begin, the less invasive the treatments tend to be. But the important takeaway here is that it's never too late to start.